Biasanya kita menyebutnya sindrom Stevan Johnson. Khas sekali ya disebut sindrom karena terdiri dari beberapa gejala, 3 gejala utama. Jadi ada lesi kulit, bisa berupa bintik-bintik dulu merah, lalu ada lepuh berisi cairan, kemudian nanti luka-luka ke seluruh tubuh. Kemudian yang kedua menyerang selaput lendir atau mukosa, mulut, bahkan kelamin tadi. Yang ketiga itu konjungtiva, mata.
Daerah mata.
Ya, jadi matanya berair. Jadi 3 gejala utama yang kita sebut dengan sindrom Stevan Johnson dan memang akan berdampak sampai kematian ya. Jadi kondisinya memburuk, syok lalu kematian. Nah, di sini biasanya penyebab utama adalah obat yang dikonsumsi lalu terjadi merah kemerahan di kulit lalu timbul lepuh-lepuh yang berisi cair kemudian meluas sampai ke seluruh tubuh. Jadi gejala awalnya seperti demam, seperti flu, lalu kemudian bisa seperti ini, meluas dan kulitnya jadi luka-luka. Paling banyak, lebih dari 50% adalah karena obat. Obat itu yang paling sering obat analgetik.
Selain itu ada tulisannya di layar kita, obat-obat anti asam urat.
Ya.
Siapa yang kena asam urat? Tuh hati-hati ya Bu ya, jenis allopurinol. Pernah dengar? Iya. Ya. Kemudian ada obat apa lagi?
Antibiotik paling sering juga.
Antibiotik paling sering, penisilin ya?
Macam-macam itu bervariasi tiap individu, bisa tergantung bagaimana respon tubuhnya. Lalu obat anti kejang betul, lalu obat antipiretik. Anti demam juga ya? Anti demam juga. Yang paling sering antipiretik dan analgetik, lalu antibiotik.
Hati-hati, makanya konsultasikan dulu ke dokter sebelum mengkonsumsi sesuatu, walaupun rata-rata obat demam ini dijual bebas.
My name is Dr. Walter Jalko. I am a lecturer at the University of Nairobi, where I teach medicine. I want to tell you something about Stevan Johnson syndrome. Stevan Johnson syndrome is a disease that you can consider to be what you call immune disease. Nobody really knows exactly what causes it. It has been associated with infection, especially in young children. But in the grown-ups, it's associated with reaction to drugs. Stevan Johnson syndrome usually presents initially as a common cold. You can feel sore throat, you can feel a little fever, and it's usually not detected early, and that is where the problem is. After the symptoms of cold, you get very severe peeling off of the skin, and the skin can peel off in different parts of the body. In the mild diseases, it just peels in very small parts of the body. But in severe diseases, the whole body is affected, and it can be very, very serious. Even in the very developed countries, the Western countries with very good medical facilities, death from severe Stevan Johnson syndrome, even with treatment, is very high. Up to about 40% of the people would end up in death. Now, this percentage rises in developing countries, like in my own country, Kenya. The disease is very rare, but the people who get it are usually dead within the first month. So for us in Kenya, it is a very serious disease with very many people dying. I personally have not seen any of the patients with Stevan Johnson syndrome surviving. There is no treatment for it. We just feed the patients with tubes. We give them a lot of fluids, a lot of water, but there is no known drug to date, even in the Western world, which you use for treatment of Stevan Johnson syndrome. I hope this information will be useful to you to know that Stevan Johnson syndrome, what Stevan Johnson syndrome is, and that it is actually a severe disease. I had a privilege of meeting Reverend Samuel in a course in Hawaii, Maui, and he is the first person I've met personally who recovered from Stevan Johnson syndrome. I had a privilege of talking to him. He showed me some of the pictures that he had when he had the Stevan Johnson syndrome. In my opinion, it is a miracle. I have not seen, as I mentioned to you earlier, I've not seen anybody recover from it, and it was such a good experience to meet Reverend Samuel and talk to him and see the pictures, how severe the disease was. And now when I look at him, all the skin is recovered, it's in perfect condition, and to me this is really, really fantastic. I have never met somebody with such a condition who recovered. So what can I say? I can say to God be the glory, great things he has done. It's wonderful to meet Reverend Samuel.